So when we're looking about our reactions to stress and fear, we are looking at the fact that our fear responses are based on our early experiences of stress. So that has to do with attachment. That's why I'm recommending Therapist Uncensored, so you can really understand what attachment means and that bond, your bonding experience with your first primary caregiver. So when we're stressed, did our caregiver meet us and soothe us and basically give us the experience that stress and discomfort is normal, and though it's uncomfortable, it's not something to avoid because it eventually passes? Or was our caregiver a source of stress in and of themselves? Here we are wanting to be closer to this person and have a warm, meaningful relationship with them, and on the other hand, they are causing harm to us and creating more stress for us. So therefore, we learn that stress is bad, stress is something to avoid, stress is something that's overwhelming, as opposed to just a normal part of our existence. So what's important to understand is that stress now feels the way that it did years ago. Something new that I learned was that, and it makes sense, is that emotions are experienced way more intensely during the adolescent years. And in the Therapist Uncensored podcast, they mentioned the adolescent years go from about 11 to about 24 or so. So emotions are very strong at that time. And if you don't have good guidance, then you're going to be confused about what's happening with your emotions and the signals that your body is giving you. And you're going to be more influenced by your emotion and feeling not in control. Things that contribute to the way our emotions feel, our experience feel, are thoughts. And if you think about the kinds of thoughts that you have when you have self-doubt or guilt or uncertainty or fear, you probably are having the same kind of thoughts that you had going back to middle school or younger. So again, the purpose here, the question is for you to reflect on your own is, what happened to make these things feel this way, the way that they do? So just briefly about the Adverse Childhood Experiences study. So this was done in 1997, or started in 1997, and looking at difficult experiences that people go through their childhood. And so they came up with these categories here, but obviously there's a lot more. But this is what was studied, and then this is what they were actually able to identify as being more common in people who experience one or more of those categories of risk. So you have all of these problems, physical and mental, that contribute greatly to suffering in our society. So we're looking at how you are challenged. And again, this is an opportunity to get participation from you and how you are challenged. So I'm just going to briefly ask you to indicate what's been the most difficult for you. I think there's maybe just one response allowed here. I'm not sure, but just take a moment and let me know how you are challenged. So, it's multiple choice, so you can pick more than one. So, and it's anonymous, so not to worry. Okay, so one person voted and waiting for the next person, and thank you. And 5 more seconds, 3, 2, 1. All right, so here's the results: feelings of numbness, changes in appetite, difficulty concentrating. So very common and difficult experiences that we're having. So as we go along, we're going to be talking about the use of metaphor and imagery. And obviously when things feel scary and unsure, we would rather that we felt safe and protected from all of that. So this image is very nice. Please don't think of Jurassic Park. Think of this image instead. Much better image. Very wonderful place, very calming and relaxing. And then, so how do we get to that place? How do we get to feeling safe and protected? Well, what we're going to do in this next half hour or so is help you to erase some of your old images of chaos or vulnerability, help you to manage how your body feels, and then create some new positive images for yourself. We're going to be doing a process which is similar to memory erasure. And so it sounds a little strange, and it is definitely not like what happens in Eternal Sunshine of the Spotless Mind, but it is more along the lines of emotional memory. The next picture is a close-up picture of a spider, so please be aware of that. But this spider is in reference to a study that was done on memory reconsolidation and how spider phobia can be reliably removed using this process. In Amsterdam, they use a drug, propranolol, and they have different attitudes about drugs in general in Amsterdam. But in our country, it's hard to get drugs approved for studies. But in Amsterdam, they were able to use propranolol to block the fear response. And you can see on my website and also on my Facebook page a video clip of the spider study and how they did that and how this person came back. And the next day after receiving the medication, well, I'll tell you just briefly because this is part of the formula of reconsolidation. So you are exposed to a stressor and a stress response is elicited. So if you're in the spider study, you're put in front of a spider that's in a terrarium across the room from you. So you then go ahead and you have your fear response. It's activated nice and good, and it's pretty juicy and very uncomfortable. Then they give you the beta blocker, the propranolol, then you go home. The propranolol blocks the fear memory from reconsolidating back into long-term memory. Long-term memory is what we rely upon when we react to things. That's what our emotional brain relies on. We don't remember the first time we had a bad encounter with the spider. We remember the last time we thought about our encounter with the spider. And oh yeah, the last time we thought about it, it was pretty freaky deaky. So yeah, there it is again. So with the propranolol, and you'll see with eye movements, that fear memory can be blocked, and then you no longer have that fear memory. You come back and your brain goes, oh yeah, last time we saw it, which was yesterday, that fear response was kind of blocked and it's not a big deal anymore. And the person has a no big deal kind of response. So we'll be going through that today for yourself. All right, so, and again, we use imagery and eye movement or bilateral stimulation to facilitate this process. One of the best ways of using imagery is by using metaphors, and metaphors are very valuable and very important in the literature, and you can look up metaphor and acceptance and commitment therapy, and they have a lot of good stuff on metaphors, and I'll have a post out about metaphors too. But metaphors are really just a kind of a shorthand that let us think about the world. And I don't know that I have spoken any metaphors, but maybe I have in this conversation. But it's important because it helps us think of new ways to think about behavior. So again, how do these work for you? So, look at the anxiety and the depression ones. Anxiety is like struggling in quicksand or walking around in concrete boots. Getting rid of depression is like trying to dig your way out of a hole or lift a tremendous weight off of you or to come out of a fog. So these images are very important, and it's very important in the process that you trust the imagery that your brain gives you, trust how it feels, put your thinking brain aside and not worry about does it make sense or this is hokey or am I doing this right? None of those matter. What matters is how does the imagery you're coming up with make you feel, and does the imagery give you the desired feeling? So you're using your imagination. So you are going to use the metaphor maybe to describe what your problem is like. You can build on what you know. You don't have to worry about convincing yourself. Like I said, you don't have to have your thinking brain tell you, okay, fine. So there you go. Some important one here also is to make a new story, coming up with a new story. And so I have this example from an NPR story a few years back on editing your life stories can create happier endings. And this is a story of the reporter's 2.5-year-old nephew who gets very frightened in a toy store when he is just wandering around, turns a corner, and boom, there's this 4-foot tall Frankenstein monster because it's, Halloween. And he is extremely startled and runs around the store and looks for his mom. And, he's very upset and not consolable. And he keeps talking about the Frankenstein monster. And he gets in the car and he keeps talking about it. And then finally, he just comes up with the new ending and he says, yeah, there was this Frankenstein monster, and then I pooped and peed on him and he ran away. And then that was the end of it. So really, it is that simple. You might not think so, but it is that simple. And the trick is to get past the reluctance or the mental barriers or the critical thinking that says, no, it can't be that easy. So we're going to do, again, like I say, we're going to do a little bit of this today. So some ideas for imagery, especially for difficult thoughts, is like Neo in the Matrix and stopping those bullets. Those bullets are the thoughts. Look they stop right in front of you. You pick one out and you go, oh, isn't that interesting? And then you just flick it. You don't give it any attention. Thoughts are like that. We can give them attention or we cannot give them attention. In cognitive therapy, we say to think about your thoughts differently or go on to the next thought. Well, thoughts can be really sticky. So using imagery can help you practice letting go of the thoughts. Or, you can destroy the messenger with a mighty sword. Whatever it is for you, trust the imagery that your mind is giving you. You can also rely on your own experience. So if you want to say that you can handle the stress of getting up in the morning and not feeling like starting your day, you could imagine yourself in an area of competence and how do you manage obstacles when they show up. You could even imagine how you sort the mail and the ease with which you discard, junk mail. You don't even give it a second thought. You just discard it. So your own experience can be useful when you're going through the reimagining and mentally rehearsing the new way you're going to be responding. So the memory reconsolidation, again, the process to summarize is to elicit the fear or stress response, use eye movements to reduce that fear or tapping, which I'll talk about in a second, or use any kind of imagery, again, to mentally rehearse what does that look like?